Good evening, everybody. Welcome to the Geffen webinar on fertility preservation. We're expecting more people to join, but I think we'd like to give respect to those who've joined on time, and so we're going to start on time because we've got plenty to cover today, this evening. So I want to welcome you to this webinar, which we've been thinking about for a long time. Nishmat and Geffen joined I'll just tell you a little bit about our project, our program. Nishmat, Madresha Nishmat in Jerusalem, and Karen Geffen also in Jerusalem, joined a few years ago to train Yoetzet Halacha to be Yoetzet Halacha fertility counselors. And we provide a free service to women and couples who are going through the fertility journey to give halachic, to be a halachic address for any questions that arise during that journey regarding anything that they have to deal with during that and their on their fertility journey. Tonight I would like to welcome our panelists. Dr. Karen Freidman, the head of Karen Geffen, Yoetzet Halacha Robin Jacobowitz, and Dr. Jordana Hyman, IVF specialist at Yoetzet. Before we begin, I'll just give a little bit more detail about our service. We provide an address for questions at all stages of fertility. It may be at obviously for fertility preservation, but at the beginning of on the fertility journey, whether it's the examinations, if it's IUI, IVF, or questions that may arise regarding NIDA, mikvah, ovulation before immersion, before getting to the mikvah. We also deal with the more complex questions of donor sperm, donor egg, surrogacy, PGD, recurrent pregnancy loss, sexual implications of the fertility journey. And tonight we hope to address what's special about our service is that we culminate the three pillars of the medical, the psychological, and the halachic pillars that make up the questions that arise in the fertility journey. And so when we provide halachic answers, it takes into account the psychological and medical issues that are involved. We meet our clients through Zoom or personal face-to-face, and often there's a lot of follow-up phone calls and WhatsApp. Tonight we hope to address any questions that you may have, but if we don't and we don't manage to address everything, then we invite you to contact us, and we'll send you by email the details of how to contact us to make a personal consultation in any personal questions that you may have that we were unable to address this evening. I would like to thank Dr. Karen Freidman, who's partnered with us on this very important project. And when we started it a few years, we didn't realize how important it was. We knew that there was a need, but as we've developed and our partnership has flowered, we've seen how much there is to do in this field and how much we're able to, thank God, we're able to help women and couples in the questions that they're dealing with. So thank you, Karen, for your partnership. And I would like to invite Karen just to tell us a little bit about Karen Geffen, in general, what you do, and we'll go from there. Thank you, Karen.
Hi, good evening. Or from where you're coming from, maybe it's good morning. But Geffen provides emotional and mind-body support to any fertility challenged women and sometimes couples in Jerusalem, Greater Jerusalem area, and through Corona all over Israel. What we do is we offer support groups in mind-body therapy, yoga therapy, different alternative therapies. We know that 30% of unexplained infertility, if you lower stress and depression, you tend to get that much more help in bringing women towards motherhood. What we found at Geffen is that a lot of times women were coming to us in later stages. They've gotten married later in life, got married about 37, 39, and they were kind of shocked that things were not going as they were supposed to be going. And from this, we decided to start our workshops on fertility preservation, meaning that women's, Jordana, Dr. Jordana will talk to us about it later, but there's a time where your fertility is the best time for you and the time that it goes downward. And we felt that women between 30 and 35, if we could encourage them to come to a workshop in which they can explore fertility preservation, this would give them a possibility later in life when they do tend to get married to reach motherhood. In these workshops, the things that we started exploring were, first of all, women had to come to the terms with the fact that they were not where they thought they would be, let's say age 30, 32, 33. They thought at this point they would be married, they would be having children. And we needed to give them the support saying, okay, it doesn't always happen the way you want it to happen, but we want to help empower you to take the fertility into your own hands and to go forward. So in these groups, I'll just say, basically we explored what does it mean psychologically to do fertility preservation, economically, where do you do it, which hospital, medically, what does it mean? What does it mean to put hormones in your body? And I'll leave it to you guys to discuss it, and we'll come back later and I'll give you more of what went on in the groups.
Thank you, Karen. I just would like to say, invite everyone that if they have questions they would like addressed during the webinar, so please feel free to send your questions in through the question and answer application in the chat in the Zoom. And we'll hope to try and address as many of those questions as we can. So I would like now to invite Dr. Jordana Hyman to give us a little bit of a medical background of fertility preservation in order to continue this conversation.
Okay, thank you. It's a real honor to be here with my friends and colleagues tonight and with all of you. I've been working with the Nishmat Geffen fertility program from its infancy, or from planning at conception, and I've been privileged to run the medical curriculum and learn a lot, both halachically and psychologically along the way, which in turn helps me help my patients. And we have an ongoing relationship where we interact and ask each other questions, and the Yoetzet turn to me if they have medical questions along the way in helping women. I practice in Shaarei Tzedek Medical Center in Jerusalem, and I think that we have one of the largest volumes of eggs frozen at the moment. We have over 500 women who have frozen their eggs in Shaarei Tzedek from the time that egg freezing became possible in Israel. So really we're talking about the last 10 years, and most of the women have frozen their eggs in more the last 5-6 years. The first few years they were like, dribs and drabs, and it was more of a taboo topic. And over the years it's become something that is much more discussed and known about. There's a lot more support out there. I will say from the outset that a lot of women come to freeze their eggs feeling very alone, very lost, very unsupported. And I think it's wonderful that we're able to refer to services that offer support both psychologically and halachically, because a lot of these women stress how alone they feel going through this process, which, as Karen said, is usually not a process that women enter because they necessarily imagine they'd be at this stage. It's sort of where they found themselves. And I totally agree with Karen about the empowerment. You'll probably hear that word a lot this evening, of giving women choices and helping support them on wherever they are on that journey. I'm going to talk about the Israeli system, although I'm aware there are some women here from overseas which may have different regulations, and also the systems may be a little different. But in Israel, we are freezing eggs for women between age 30 and 41. Women are allowed to freeze up to 4 cycles, or until they get to 20 eggs. So if a woman has 19 eggs frozen, she can come back for another round. If on her first cycle she has 27 eggs, then essentially she can't do another round. The egg freezing process in general is considered private or self-funded, although there are 2 Kupot Cholim that contribute in part either to the medication or part of the process. But as opposed to fertility treatments, which are funded in Israel for up to 2 children, fertility preservation is considered a private choice of the women choosing to do the process, and therefore it's an out-of-pocket procedure. Why are we offering fertility preservation? So fertility preservation was something that first arose as an option for girls, women, also boys and men undergoing cancer treatments, chemotherapy, or different kind of medical therapy, or with other medical different illnesses, systemic illnesses, with medical problems that stood to potentially compromise their future fertility. And the option of freezing eggs, embryos, sperm, what have you, arose as a way to offer some sort of option for future fertility for people who stood to potentially lose all their fertility options if we didn't offer something. And essentially, the fertility preservation that we're offering people who come to do egg freezing is based on that concept. And here, the huge factor is age. As Karen hinted, fertility for women declines with age. And that decline tends to pick up in the slope and in the pace of the decline somewhere around the mid-30s. It can be very individual. So we have some women in their early 30s with very poor ovarian function, and some women in their 40s still with excellent ovarian function. But we tend to say, as a general rule, that around the mid-30s is when we see the decline in fertility. And essentially what fertility preservation or egg freezing offers women is the opportunity to freeze their current fertility potential for a later stage when they find themselves with a partner and ready to start a family. So most women, I'm sure you've all heard about Google offering their employees to do egg freezing and women doing egg freezing so they can pursue their careers. In Israel, we haven't found that to be the case. In Yoetzet, almost everyone that froze their eggs were not doing it because they were pursuing a degree or a career. They were doing it because they were at the time of freezing not in a relationship and wanting to delay having children until they were in a relationship. And that image of the professional career woman trying to push off her childbearing until she completes whatever she needs in her training doesn't seem to apply as much in Israel, and probably not in other places around the world either. That essentially most of the women are coming to try to hold on to that fertility potential and essentially put in a long-term deposit or an insurance policy and we'll talk about that insurance policy as the evening continues, for a later stage when they may not be able to conceive naturally. Again, I'm going to talk in terms of ages in general, but it's really important for me to stress from the outcome that fertility potential is something very individual. And besides age, we assess it through a variety of tests, including blood tests and ultrasounds, which give us a more accurate assessment of the woman's current fertility and may help guide in the decision making. So I'll explain a little bit about the process and then we'll open up the conversation between us. For a woman who's decided to go ahead with the process, in Israel, it's done through a hospital. So women come to a hospital to basically start the process, and they may or may have not already completed the tests that are required before starting treatment. So some of the tests are tests to assess the current fertility, as I've said, an ultrasound, hormonal blood tests, the classic ovarian reserve test of AMH, anti-Müllerian hormone, which gives us a specific indicator of how the ovaries are functioning. And besides that, we have general tests of virus screen and a breast exam because a woman's going to be exposed to hormones, a pap smear if that's relevant. So there's a bunch of tests that a woman needs to do before we start the process. And essentially there's a preparation stage where we plan the treatment protocol and prepare and have a teaching session with one of the nurses. And then we get to the actual treatment itself. The treatment usually is around a 2-week process that most often starts during the menstrual period and involves daily injections of hormones. And during this 2-week period, women are followed up with regular blood tests and ultrasounds every 3 to 4 days for us to follow how the eggs are being stimulated and developing, which we see from the developing follicles. So what happens is during a normal menstrual cycle, a woman usually releases 1 egg when she ovulates. And our goal with fertility preservation is to try to stimulate all the potential eggs for that particular cycle to grow to maturity so that we can collect them and then freeze them for future use. So after the 10 days to 2 weeks of hormonal stimulation, we perform the egg collection, and that's done usually under general anesthetic and in a hospital. It's a procedure that may last somewhere between 10-20 minutes. Usually a woman's in the operating theatre for around half an hour and stays in the hospital for 2 hours afterwards. On the day of the egg retrieval, we can tell the woman how many eggs we've retrieved, and they're usually checked for maturity around 4 hours after the collection and then frozen for future use. At the moment, what we offer is a 5-year freezing. So from the time that the eggs are frozen, they're frozen for the next 5 years, but women can keep freezing their eggs and actually use them till age 54. And the challenges that those eggs then face, which we can never know for sure what the future of the eggs are going to be, but those eggs are going to need to undergo a warm or thaw because we've frozen them, and then they're going to need to be fertilized, and then the fertilized eggs will then grow to embryos. So there's quite a few challenges still waiting for those eggs in the future. I'm not sure if I should stop and open up for questions, or if there's anything extra you want to ask at the outset. Michal, maybe you want to direct me if there's anything else about the process.
How long will the eggs last? Because you said they could freeze from 5.
So they could freeze for a very long time. Studies from units that have frozen eggs for a really long time, like more than 10 years, and women that froze eggs because of cancer treatment or other reasons are showing that the length of time that the eggs are frozen doesn't seem to have any impact on the success of the future treatment or on the health of the children born. So it looks like at least 10 years. I think it's important to bear in mind that in the beginning, most of the women that were coming to freeze the eggs were more around the 37, 38, 39 sort of age bracket. And now we, as medical professionals like you, are aiming to try to recruit those women in their early 30s to come and freeze. And it may be that they'll freeze them for longer, because essentially what we recommend is that when women are ready to start a family, they leave these frozen eggs for the last babies. They don't go straight for the frozen eggs. They try to get pregnant naturally. If that doesn't work, they try fertility treatment. If that doesn't work, they may try IVF with their current eggs, and only later turn to those frozen eggs, which essentially may extend their natural fertility. So while a lot of women who froze at 38, 39 seem to be coming back more like 43, 44, okay, not very much later, so that's what we've seen so far. I think for the women that are freezing at 32, 34, it may take, their eggs will be frozen for potentially a really long time. But as I've said, in studies that look, there's one American study that came out this year, the author is Blakemore. They look at a 10 to 15 year follow-up, so they've got a really long follow-up, and some women froze for a really long time. And again, they're echoing that conclusion that the length of time that the eggs are frozen are not affecting in any way the outcome or the health of the future babies, which is obviously a paramount concern. If women are doing this to have children, they want to know that those children are going to be healthy.
Okay, and how does this affect the health of the woman?
Okay, so aside from this being, I would say, a challenging time emotionally for women, it's a pretty sensitive decision that some women really spend a long time in the process of making a decision to go forward. It's important to know that during the time that women are taking hormones, those hormones can affect women in a variety of ways. I tell women that besides from having to come in for blood tests and ultrasounds, which can be very dominating during your day-to-day existence, that it's wise to do it during a time where your work or studies can give you that flexibility. But I also talk about the different side effects that the hormones may have, and they could be a big range. It can affect mood, appetite, cause headaches, affect the gastrointestinal tract if it's nausea, vomiting, diarrhea, may cause swelling or bloating or temporary weight gain. We're always concerned about the long-term risks of any hormonal treatment in breast cancer, which is why we always do a breast exam before treatment. And for women doing 1 or 2 cycles of hormonal therapy, there doesn't seem to be a long-term risk, but we would recommend yearly breast screening after any hormonal treatment. The collection itself also can have risks. It's usually performed under general anesthesia, so it is a procedure under anesthesia which has its own risks. And the eggs are collected with a very fine needle. It's a vaginal collection. The needle that collects the fluid from the follicles can occasionally cause bleeding, introduce infection. In the area of the ovaries, there's bowel, there's bladder, there's other organs. Usually it's considered a very low risk procedure, but it is important to know that there is some risk involved. And I think it's important that women know that and understand fully, although not everyone is capable of hearing that. And so we have it written down and we explain it with the doctor's visit, and also the nurse revises that in the teaching session. But I wouldn't say it's a completely sort of innocent, simple treatment and procedure. That it can be uncomfortable. It can be very painful for some women. It can really affect some people's mood and appetite. And my advice to women is to try to engage as much support, if it's from their friends, from their family, from their support group. Be kind to yourself when you're going through this process. If it's gentle exercise, if it's yoga, if it's relaxation, This is a time where you need to gather your resources.
That's what we found. I just want to say that that's what we found in the Geffen groups. There were a lot of women that came in, and because they felt there was a stigma, or because a lot of them were religious and didn't want to really tell their parents, these women basically banded together. And when it came to doing the operation, doing the procedure, they would go with each other.
Right.
And that really, that support was really amazing. And let's say somebody felt bloated or somebody felt nauseous or whatever, they could call each other and everybody was doing it together. And I think that support is so important when you go through this. I just want to say another thing that happened when we keep talking about empowering, but I really feel that this is true, that when we started these groups, all the women would put the counselor, the psychologist together on a WhatsApp with them. And at first, all the questions were, where can we get the drugs in a least expensive way, etc. Which doctor do you like? And that would be the first few weeks. And then they would start saying, you know what, I've got this place where we're going to get fixed up and there's a party going on. And the dating just started more. And I feel like these women were empowering themselves and they were going out more and they were feeling like, okay, I'm taking control. And what's so important is that after I do this, it's not that on the second date I go on when I'm 33, I have to ask the guy, what is he going to do for a living, et cetera, and run after him. And then the guy's running away. And you can go in with a sense of self-respect that this doesn't have to be the only one I'm marrying. I can choose. I'm the one in control. And I think this is just a much healthier way to do things.
Yeah, what Karen's saying is true. I've seen women who do come in with a woman from their support group or a friend or someone that's been through it. And I think it's amazing to have that opportunity to not be doing it alone. We did have in Yoetzet recently one woman who hadn't told a soul, and we couldn't release it because you can't send someone home after anesthesia alone. And she was like, I'm not telling my family. I have no one to call. I have no one I want to tell. And that's hard. And I think that the more that we can offer support in whatever way we can, just makes the process that much easier and makes it much more normalized and a lot less taboo. Because I feel like in the beginning it was extremely taboo and people didn't want to talk about it.
I mean, now men, when they're getting fixed up and the women
They
want to
know.
know, yeah, we know how she throws in her eggs. That's one of the things that just comes up in discussion.
Yeah.
Which is amazing.
Which is, I guess, new and a symptom of that these times.
Right.
Robert, would you like to fill us in a little bit? A lot of people say, what do the rabbis say about fertility preservation?
So that's a good question. So we talk about the halachic imperative in Ishmartam L'Nafshotechem, that we have to take care of ourselves. So we have to balance going through this procedure, which has risks, along with just taking care of our health. And I think every woman has to judge those variables in her own life and her own health when making the decision. We've gotten a lot of questions from women regarding the treatments on Shabbatot, like doing the injections on Shabbat, and we've discussed with rabbis that that's permissible. If you can prepare the injection before Shabbat, that's preferred, but not necessary if you can't.
So also Karen mentioned that that sometimes a religious woman would maybe hide the fact that she was doing it. Is this something that religious women should be considering or encouraged to do? What's the religious community saying about it?
That's a really good question. I don't know if I have such a comprehensive answer. I think different parts of the community are saying different things, and every woman should research in her community what the reactions are, if that's important to her.
Is it a halachic problem to do?
No, but as long as a woman's taking care of her health, if it's too risky, maybe it is an issue, but if it's not too risky, then she's encouraged to do it.
And why would she be encouraged to do it?
Why would she be encouraged? Because really, if she wants to have children, it prolongs her opportunity for fertility. There's no guarantee, but it certainly offers her more options and more time.
I'd also like to just go back to Jordana for a minute. You were talking about 2 weeks of injection of actual protocol and then anesthetic. So if you need to make time to be able to do it, how long does the whole process actually take?
Well, it depends when you're considering the whole process starting. If a woman comes and her first appointment, and she's got all the paperwork ready, and all the tests have been done, and those tests, the lists are readily available. They're available on the Yoetzet website. They can be, all hospitals have a list of the tests. Also gynecologists can send women for these tests before. So the process of, there's the, I guess I'd call it the bureaucratic process of getting the paperwork ready, having a teaching session. If everything can move forward smoothly, then we're talking about within a month or two, a woman is usually able to start if she's completed all the tests. If she hasn't done any of the tests, some of the tests need to be done during certain days of the period. Some of the tests take a while to get an appointment for, so it could take a month or two to complete the tests, and then start basically the period after that. I would say that around half the women who are going to go ahead with egg freezing do take a few months to get ready, and also various, I don't know, my brother's wedding, I've got this review due, I've moved jobs. I'm thinking of the reasons that women may delay. That I've had this all in the last few months. New jobs, moving cities, smachot, all sorts of reasons that women don't want to go forward straight ahead. And the fastest has been within a month. So a woman came and opened a file, and within a month we started treatment, and today I actually did her collection among the 10 today, but she super sped through it all. But I guess part of that is an issue of how motivated people are to get through all those tests, and that might be a personal or practical issue, and also what their schedule is like. Because I do encourage women to make the time to do this when they can also emotionally have the time to be supported and not be rushing through this. And also have the time in terms of their day-to-day responsibilities where they might, have a little more free time. So in general, in the summer, we suddenly have this influx of teachers who suddenly that's when their free time is, because it's very difficult to be available for all these tests when you've got to, open a gun at 7:30.
And they finish by the 1st of September, or that's difficult.
Yes. But then again, we're going back to, are we doing one cycle? Are we doing two? Are we doing one cycle now and another one in 6 months? And also, I give women an indication of how urgent this might be. So there have been some women that on the basis of their tests, I've said, I think we need to start in the next month or two. So if they didn't want to be stressed, that may add stress. And some women I've said, nothing really looks like it's going to change in the next 3 to 6 months. The tests look great. Let's think about when the best time for you is going to be, because I really do believe that is important and impacts how the women experience this whole process. And I want them to go through this. I also want them to get the highest number of mature eggs that we can get for them according to their personal tests and ovarian reserve, but I also want it to be a positive experience. And I think there are also a lot of women out there, Michal, who will come for a consultation, and it may take them a year or even 2 until they actually come back and go through with it. I've had many patients who have had to have several consultations and think about it and consider it and talk.
I've gone in and out of our groups and
Yeah,
and they've
gone
asked
to
if they can
groups.
come back another time.
And also some women are dating and they don't necessarily want to go through this while they're dating someone who they just met, because they don't want to be cranky and bloated, and they don't necessarily want to tell the person they're dating, or they don't know where the relationship might be heading. So they're debating going ahead with it or waiting to see where the relationship goes. So there are a lot of factors that may impact the timing, but I guess it could be anywhere from the next month if everything is really super organized and efficient and the stars align, and some women choose a much longer time span.
I want to ask you a question, because I had a case, it was about a few weeks ago, where a woman called me up in tears. And she called me up, she was about to come and do counseling for fertility preservation, but she happened to go to the doctor first. And the doctor basically said, listen, you're 38 years old, but right now it's too late and you can't freeze anything. And the only way that you can have a child right now is if you just do this right away. And basically threw it at the woman. She called me in tears what to do. I wonder if you get a lot of women that are just either they're in their late 30s or because of their biological, there's something that says there's an urgency of doing it. And there's also been questions in the groups of when people, like when doctors say things like that to them, it's a halacha question. How do you handle it? Where do you go? So I want to ask both of you, like, what do you think? Maybe Jordy first.
Yeah.
Okay.
And what would you say?
So, firstly, there can be women not just age 38, but also younger women whose ovarian reserve tests show that their ovaries are functioning, unfortunately, at a more advanced reproductive age than what we would expect. Sometimes because of a genetic reason, which because of the tests we can explore and find out and maybe offer different sorts of interventions. There are also some women, by the way, who come at age 42, 43 and are shocked that they can't freeze their eggs. So they didn't know that you can, there are some women that we have to reject because of their age straight away. And there are some women, particularly at the later end of the, late 30s, 40, that their tests show very, very poor ovarian function, where we would be lucky to retrieve one egg or maybe more, where most doctors at that stage would feel that it would be really giving false hope to go ahead and put all that money and effort into potentially freezing something that has very little chance of even getting to 1 or 2 eggs. And at that stage, the chances, future chances of those eggs surviving the thaw and undergoing fertilization are probably very, very, very reduced. And the chances of a live birth, which is the desired outcome, can be very, very low. The ovarian reserve tests in general predict how women are going to perform with their egg collection. They don't necessarily predict the chances to conceive now. So some doctors might say on the basis of these tests, an egg collection is likely to be very unsuccessful, but you may still have a fertile window to try and conceive, which may have been the message that was relayed to this woman in tears. I don't know, because it wasn't me and I wasn't.
No, that
I
was
was not
the
there,
message the woman got. It was
yeah.
a religious woman, and the doctor said, you want to have a child, you just should do this now.
So that's a pretty harsh message. I mean, I usually, as I've said, my goal is to empower women and give them the information. And I want them to know that at all stages, they're making active decisions. So I usually discuss it in terms of the options that women can choose to do going forward, can choose to take the paths they could choose to take. So I say, some women might be listen to come for a consultation and decide, what, this isn't for me. I don't want to do anything that might be risky. I don't have the money for this at the moment. I can't bear the thought of injections. I'm not doing this. So some women might come to the consultation and choose not to do anything. That's a choice. That's an active decision. Some women decide after all of this that they actually want to explore being a mother now and not waiting. That's not most women who are coming for egg freezing, but some women do decide to go down that path. And some women choose to go for egg freezing, and some women also choose to fertilize either all or some of those eggs and freeze embryos. And it's possible that at this stage, most of those options weren't really an option for this patient because of her tests, and that the doctor felt that it was not really feasible or not in good faith to offer go ahead with the treatment where the chances of success are close to zero. Can't prevent women from trying up to a certain age that they have the right to do it, but it's still a financial and emotional and physical investment that may just not be justified if the chances of success are so incredibly low. And it is possible that there's a time in a woman's life where the chances of succeeding with preservation are extremely low, but she may still have a window where she's able to conceive. And I've had women who are told your chances are extremely low at anything at this point, who have then gone on, got married and conceived. People whose ovarian reserve tests look like they have less than a 1% chance of success in IVF, or have been told we can't offer you anything. And this is not necessarily egg freezing, but any sort of fertility treatment.
Sure.
Who have gone ahead and conceived. So it's important to realise that the tests are there to help us predict response to treatment and how many eggs we think we're going to collect, but not necessarily what are the chances of getting pregnant right now. But the option of getting pregnant right now is not really an option for the vast majority of these women. And I think that sort of suggestion for a woman who's coming to freeze her eggs because she wants to preserve her fertility for the time when she'll have a partner is, a total emotional turmoil whirlwind. I know that's how most women respond when it's put on the table as an option. And I imagine that both psychologically, emotionally, and halachically, it's a huge challenge.
Yeah, I mean, the halacha comes in, most of the women that come to Geffen, I won't say that they're religious, but I don't think you're going to find many people in Jerusalem that are anti-religious. Everybody is got somewhat of a Jewish feeling, and the religion does play part in it. And that is something where women really do, it's an added stress factor where they don't know exactly. That's why I'm so happy that they do have Nishmat to turn to with all of these questions. And I guess I would love you to address what you would feel about all of this.
Right, so we generally say that we would prefer for the women to have a partner when they're going through the treatment in terms of having actually pregnancy. And certainly freezing an embryo is more complex than freezing an egg. Embryos present a lot of halachic questions, which if a woman does decide to freeze embryos, then we encourage discussing it privately in terms of all those variables in the case. But embryos are a little more, although they might preserve a little bit better, they're a little more complex from the halachic side in terms of identity and genealogy.
So, but Nishmat, what I feel is that, let's say a woman, there's many different paths. This is something where Nishmat will discuss all the different paths
Yes.
with them.
Yes.
And there's nothing that's taboo, and there's nothing that's that you say the blanket no. It's more like every
We
case
discuss.
you'll take and you'll
Yes,
discuss. and
every
you'll go
case is
through it.
unique, and certainly every woman is unique, whether it's for egg freezing or beyond. Every woman's physical and emotional and financial states factor into any decision process. And each woman is a unique case.
Jordana, if you could just, we were just talking about when there aren't a lot of eggs to freeze. Let's look on the positive side. What about when we've got lots of eggs to freeze and then the woman gets married and has babies naturally? What happens to these frozen eggs if they don't use them?
Oh, okay. If they don't use them, that's the bracha that I give to a lot of women when they come, that they shouldn't need them. And they should remain frozen, but they aren't going to remain frozen forever. So I talked before about the 5 years. So when a woman signs up for the egg freezing program, they're essentially frozen for 5 years. And after 5 years, the hospital turns to a woman and asks if she wants to renew the freezing for another 5 years. And essentially it's sort of sold in 5-year batches of continuing to freeze. But women are asked to nominate what they would like to do with the eggs should they not use them. And the options at present in Israel are either that the eggs are defrosted and discarded or thrown out basically, or the other option is to donate them for scientific research. At present, I mean, they can't be used for creating an embryo, but they can be used for all sorts of different research on the survival of the eggs and different exposures to different medium and all sorts of different research that's going on. At the moment, we don't have an option or a clear option for women who freeze their eggs and don't use them to donate them to other women who may be in real need of donor eggs. I'm hoping that in the future this will become an option for us in Israel. It is an option in other countries for the surplus eggs. As I've said, of the, more than 500 women have frozen their eggs in Yoetzet, and only just over 50 of them have come back. So I don't know what's going to happen to the other 450, and we're adding to that number constantly. But I imagine a lot of eggs are going to remain frozen and not used. So I hope that in the future we'll think of better options and different ways we could use those eggs for something positive. But they definitely can't be used to create embryos or given away, and particularly in Yoetzet where all cases have a mashkicha. Women can feel very confident that their eggs will only be used for them, or whatever they nominate the eggs to be used for. And other hospitals have different kind of mashkiach arrangements, and I think that's important to know that your eggs are not going to be taken and used for another woman against your knowledge. You're not going to have your eggs being given out. But yes, I think there will be women who are not using all their eggs. We've got women with 30, 40 eggs who I don't believe are going to use most of them. And then we have women with smaller numbers that you asked about, the big numbers. So an important question that I'm asked is, if there's more than 20, are they going to throw some out? No, we're going to freeze every single mature egg that we possibly can. Yeah, I think the record for me was 53.
Wow.
And that was a surprise. we didn't expect anywhere near that. And yeah, so I don't think this woman is going to be using that many. She probably won't need to use any for quite a few years, if at all.
So when a woman is in her 30s, how is she supposed to make this decision? What are the type of considerations that would help her decide, is this what I should be doing? I don't know who wants to answer
Doing
that.
in general or doing now?
Well, if you could relate to both the options, because I think that the question of should I preserve my eggs, my fertility, it raises the question of when I should do it. But before that, maybe the question is, what does it mean about me when I'm making that decision?
I can just go back psychologically. What I feel that happens is that women who do it, who go and they're brave and they say, I'm going to take my fertility into my own hands, I feel that it's a life changer. I mean, first of all, I want to talk about the SMSs that I received from a lot of the women, 3 so far, that says, Dr. Freidman, you said that this would happen and we thought you were joking around, but I'm engaged. And I really feel that this gave me the power. I started going out, I started feeling in control. And I think that psychologically, it's amazing. If that's one thing. And then I think that seriously, like, a lot of these women do feel that, okay, every year they feel like, okay, next year I'm going to get married, next year I'm going to get married. And we really hope that they do get married, but it doesn't always happen so fast. And I just think, like, why not have all the chances that you can have? And as Jordana said, it's not such a high risk medically, like, why not? That's what I feel.
I also think it's really critical for anyone considering this to make sure that she has the proper support, because it could be physically and emotionally draining, whether it's family and good friends, and not to discount that. That really can take something out of you, at least temporarily, at least for a good couple of weeks,
For sure.
and to make sure that you have that support to be able to get through it and get to the place of empowerment and strength.
I mean, we had in one of our first groups where one of the women texted the group and said, well, I didn't really listen. I just did the procedure. Can someone help me? I have no one with me. And I had 4 people from the group running off to Hadassah to be with that woman. I mean, it's an amazing thing. But people are still shy and they still don't talk about it. And I've had so funny that I've had women in the community say, just don't tell my mother, because everybody around here sort of knows everybody. And I've had the mothers calling me and saying, listen, I know you do the groups. Don't tell my daughter I called, but can you just sort of get them into your groups? So there is still a stigma that's going on. And I think that we need to break the taboo. I think that that's an important thing. I think that rabbis should start talking about it. Community leaders should start talking about it. It should be just a normal conversation. And you know what I think? That in the high schools, especially in the religious high schools, I think they need to start teaching it. They need to start teaching that when you're 39 or 40, do not get shocked if you haven't become pregnant yet and you want to have a child, that it might not be easy. And I think without trying to stress kids out, they just need to know the information. And I think that if you do it in a normal, natural way, then I think that women will look at the whole idea of fertility preservation and when to have children in a much more healthy way.
So I think my medical answer would be, as soon as a woman is ready, the sooner the better. So it's a conversation that I try to have with women age 30 plus that come to see me generally. And I won't say to women, you don't need to do this for at least another 5 years. I may say there's no medical urgency to do this in the next months, but it's a good idea to do it sooner rather than later. Because what we do know is that as women get older, wherever they are on their fertility slope, the quality and the quantity of eggs that we're able to retrieve does decline with age. And it may not be a huge difference for several of those years. I have a patient who froze her eggs twice. The first time 3 years ago at age 33, she froze 14 eggs. And now 3 years later, at age 36, she froze 14 eggs. With not a big difference in the protocol. So same number. I don't know what to tell you about the quality or where the babies are going to be coming from, but there wasn't a huge decline. And when she came back to consult, should she do another round or not? I said, your test's looking great, but let's do it sooner rather than later before it does decline. And there seems to be evidence from the studies coming out of Spain and America, and also what we're seeing here in Israel, that the 35, 36 cutoff, so women younger than that age need less eggs to have more babies. And once you get past that, more eggs will be needed to have future fertility. So I think it is important that women know that at a younger age, the treatment is likely to be more successful. And I think we need more awareness and to make this as normal and healthy and supported a procedure and process as possible, and to remove the stigma as much as possible.
As far as you were saying that you were talking about the costs, one of the first things that I did in the groups is I divided everybody out and I said, okay, everybody pick a hospital, private, public, whatever, and come back and tell the group what the cost is, because it's always in flux and there is a competition. One of the reasons I actually did this though was this is a way to start engaging people into taking control, because once you figure out the financial thing and you discuss it, it means you're already in the
process. Yeah.
But what I also promised women in the groups, and I don't know how I did this, and I said that there's no woman going through a Geffen group who's not going to do this because of financial problem. We will find you the funding, or we will figure out with you how to do it. And really, it's not unimaginable. I think that at one point, I don't know if Hadassah is still doing it, but Hadassah was giving loans to women that wanted to do it, that couldn't afford it. And I think that if a woman really wants to do it, they will figure out financially how to take control of that too.
I mean, I think even though it's not technically funded in Israel, it's still significantly cheaper than in most parts of the world. And I have had women come to Israel from different countries to do it here because it's significantly cheaper, even if they're tourists, still cheaper than wherever they're coming from. So I think, but again, that's a personal, it is a personal issue, but it's good to know that there's assistance out there for women that need it. And there are different kinds of gemachs or different ways to find discounted medication. There are a lot of women who also donate on or hand on the medications that they don't use. And there are certain pharmacies that give special discounts to women undergoing fertility preservation. So I think the main feeling is that these women have some financial support amongst the other, support network going on. There's also some help with trying to make it a little bit more manageable financially.
Robin, do you have something to say about the stigma?
It's a very good question. I think over the years, the stigma is reducing, and I hope it really will continue to be reduced so that women can feel empowered.
We're nearing to the close of our very interesting webinar. Thank you. It's really been very insightful, the things that you've said, and there's definitely plenty to think about. And I'm sure that also those of you who are tuned in, you're thinking of very personal questions that maybe we weren't able to address. But I think the purpose of this evening was to raise the issue and just throw out the information so it should be there. And as has been kept being mentioned, to empower women to ask their personal questions to find their personal path. So just as we finish off, I'd like to invite maybe some of our panelists, if you have maybe a bracha or some sort of message for those who are tuning in, who are either considering this and not sure what to decide, or if they've already started it and they're looking for some sort of chizuk.
Okay, so I have a blessing. I'd like to say to everyone who's listening, obviously you're on a journey. Each person's in a journey in her own place. My blessing for each person that you should make the best decision for yourself, physically and emotionally, with clarity and with strength, and a decision that will enable you to move forward on the right path for you. And my blessing as well is that if you're searching for a life partner, that you should find the right one to continue your journey together with strength, love, and support and understanding.
Amen. I have nothing to add to that. I think that was beautiful. I think that you spoke for sure for me.
Yeah, I think that definitely encapsulates how we're feeling, and I think my additional bracha would be for the women that do go through this, that these are a little nest egg, a little investment or a little policy that you're putting away for that rainy day. And please God, that rainy day should not come, and you should be able to conceive naturally with your current eggs and not need those frozen eggs. I do find, as Karen sees, that women who have gone through this process are often coming back with a partner and coming back for treatment with their husbands. I feel like it's a way that women find empowerment again, and feel like they've done whatever they can possibly do. And a lot of women use that word ishtadlut, that they're doing their bit, and Hashem, some's still up to you. But I hear this from a lot of women, that they feel like they're really maxing out on what they can possibly do. And I would just like to bless women to gain as much knowledge as you can, gain information, ask the questions, come to the groups if it works for you. The information's out there, and we're here for you in different ways. And whatever path you choose, you should have hatzlacha.
Amen. Amen.
And may we keep working together.
Thank you very much. Thank you for
thank you.
Thank you for your time. Thank you for joining us, and feel free to be in touch if you have any further questions. Have a good evening.